As part of our work in both the continuous coverage unwinding and in expanding Medicaid, we tried most of all to put the member first, recognizing that individuals, their families, have other pressures in their lives, that we typically meet them at a time when they are vulnerable, when they are seeking help, and they don't have the time to work through our elaborate administrative processes or to call the right call center at the right time to give them the right information. And so we did everything we could to be clear about our communication, to be clear about what was needed, and to assist them in ways that there was no wrong door, that they were able to access multiple means to get to North Carolina Medicaid eligibility. For us here in North Carolina Medicaid and at DHHS, we live with a series of values that we talk about often. And so in many ways, these values we brought to the continuous coverage unwinding. We brought to Medicaid expansion. That focus on member, proactive communication, stewardship. But again, I think the secret sauce to all of this time was bringing the value of belonging. Recognizing that, again, advocates had worked so long and so hard to realize something for their community. It was important, if not crucial, for us to be able to give them, again, those tools and the power of their voice. That just felt right. And our staff was incredibly supportive of that and figured out new tools that would enable communities to bring that voice. And so I'm thinking about two tools in particular. One is our community engagement. We have a toolkit that we have created that gives basically the core message of Medicaid expansion and continuous coverage unwinding. It gives the details that people will need in order to access the federally facilitated marketplace or to log on to our local e-pass or engage in a local county DSS office to get enrolled. Again, these community partners can tailor that message for their community to make it work for them, whether it's in Arabic or Spanish or Swahili. They have that capability. The other tool is our Medicaid ambassador tool. So while we have associations and advocacy groups and faith-based organizations who are all eager to get involved, we also have individuals across North Carolina who are interested, who just simply want to help their neighbors. And so we've been able to put together a volunteer program that gives, again, these ambassadors the tools necessary for them to feel confident to go into their communities and help their neighbors. After 10 months, we have over 560,000 people who are enrolled in Medicaid expansion. That we have, as a program, across the health plans and our fee-for-service side, we've been able to deliver 2.9 million prescriptions. These are prescriptions for chronic diseases that went unmanaged before Medicaid expansion. We've been able to expand the number of children through our E14 waivers in the continuous coverage unwinding. Those children are now starting life with access to health, access to a robust provider network, access to those drugs and pharmaceuticals that are available to them now.